welcome to this chat with my colleague, Jocelyn Yong, the acting head of physiotherapy. Welcome, Joss.
Hello, thank you.
So today we are going to talk about return to training from the physiotherapy point of view, and my colleague Jocelyn will bring up some topics and some issues that national youth coaches should bear in mind. So Joss, with the circuit breaker and all, is an unexpected lockdown, but there are some benefits, right, from not being allowed to go out and train.
Yeah, for sure. I think one thing, even personally, when we think about not being able to train, is that it's negative, it's not good. It's gonna be detrimental to the health and well-being of every individual. But then we have to realize that sometimes not doing too much is also a good thing. So there's that aspect where things can get better when you do nothing. This is because for a lot of the athletes with a very packed schedule, especially youth athletes where they're juggling school, they are going for competitions, they're having quite a intense training regime, they actually do need rest to get better from their injuries. So an example I'll give is when someone has a cut, you won't go prodding on it. You'll put a plaster, you put some medication, and then you just let time, give it time to heal. So similarly for injuries, sometimes that's what they need. They just need to be left alone. And that circuit breaker of not doing too much will actually help the injury heal. And then hopefully with more time at home, they'll also get more sleep. Not spend more time on computer watching videos or playing games, but actually get more naps in between, getting that rest in, that will help.
But there's also a flip side, right, to the lockdown, to the enforced stay at home.
Yeah, so this is where the doing too much becomes a problem, because you have so much time in your hands. I think I would guess most athletes are actually quite outgoing, or they'll need something to do. And with quite a lot of well-being, maybe fitness enthusiasts or even fitness centers or clubs, they'll actually post up a lot of challenges. So we'll see maybe a 30-day get six-pack ab challenge or 30-day burpee challenge, to fit into that whole circuit breaker time period at that time when we thought it was 1 month, before it became 2. But so we have all these challenges put in place, and sometimes the athletes not knowing that when their coaches actually craft the home-based training for them, it's already at a certain load that they want the athletes to be at. They don't want them to actually add more onto it. But the athletes might think that, oh, I might not be doing enough, I'm just doing this home-based training, maybe I should do more. So they do more crunches, run more, and when they follow certain people online, those online individuals might not actually be professionally trained. So they don't actually have the proper guidance of how they should be doing a certain exercise in good form, or they're actually loading their bodies too much. And then the other aspect of it is not doing something. So just now we said that not doing something is good for the body, but in some instances, not doing is also bad. So if let's say they get injured during the circuit breaker, and then they think all they need to do is rest, that might be bad as well. Because for most injuries, yeah, maybe the first 2-3 days or so, you have a little bit of rest, but you do want some graduated loading to actually get the joint stronger. You don't lose too much muscle strength and all that. So then that's the other negative aspect of not doing enough to actually get that injury better. So there's quite a few scenarios that we need to consider during this whole phase and circuit breaker period.
So would it be fair to say that inappropriate loading is the most common cause of injuries?
Yeah, definitely. So all the examples and scenarios that I gave were all linked to inappropriate loading. Be not doing enough for injury or doing too little, or the good aspect of it where you're actually doing just nice for it. And in sport, the 3 most common injuries that I'll say we come across is tendon issues, muscle strains, and ankle sprains. And in all of them, the highest risk factor or the most common cause is actually inappropriate loading. So specifically for, say, tendon issues, a lot of time, or you'll see it pop up that tendons are very load sensitive. So meaning to say that if you load it too fast too soon, it will actually not be happy because it can't adapt to it, and then it'll flare up and they will get injured. Similarly for muscles, and I think all of us will have first-hand experience of it. If you haven't trained for a while and then you suddenly say an individual hasn't run for 3 weeks, okay, and decided to do a 5-kilometer run, you know, naturally, common sense, you know that somewhere, somehow it's going to hurt real bad. You know, a muscle is going to be a bit sore. And then worst case scenario, someone pulls a muscle because it hasn't been warmed up properly, or it hasn't been subjected to that kind of load that you put it through. So that's for muscle strains. Finally, joint sprains, the link might not be as clear because it's the ligaments surrounding it. But with cartilage and ligaments also, the integrity and the strength of it is correlated to the amount of load that you put onto the tissue. So if you don't load it commonly enough and then you suddenly load it too much, the integrity might be affected. Or the other thing is, for example, you might think during home-based training, you do, say, 15 minutes of agility. And then when you come back out of circuit breaker or home-based training, you do 15 minutes of agility. But the big difference is 15 minutes agility at home and in a space as wide as a court is very different. The surface is different, the size is different, and you have external factors such as competition from your peers, you know, your coach wanting you to go faster. So they might be doing the same movement, but it's an entirely different ball game. Yeah, so I think one thing to note is that coaches need to take note of that and don't expect just because you have given your athletes some stuff to do at home, they'll hit the ground running the moment they go back to training. Yeah.
So what specific injuries are you seeing now in phase 2?
So, well, a lot of athletes have gone back to training, especially with facilities opening up. And so I would say the one most common one is the hip flexors, so the muscles in the front of the hip. Because interesting to note is if you look at a lot of home-based, high-intensity interval training exercises, they target a lot of the muscles in your front. When you don't have equipment and you want to get your heart rate up, you know, naturally you think of, say, doing high knees, tuck jumps, burpees, you know, so those really get your heart rate going, get you sweating a lot. And it doesn't really work the back of your body, you know, your upper back muscles, your glutes, your hamstrings. Because a lot of times I think those you'll think of having to have some form of resistance, be it like bands or barbell, to actually get those movements going. Or again, like, you know what I talked about, getting that core and that six pack. So with core exercises, people again think it's all about the front abs, you know, so they'll do a lot of bicycle crunches, V-mans, mountain climbers, but these all load on that front hip muscle. Yeah, so it has translated into quite a few of the athletes getting those hip flexor strains, unfortunately. Yeah.
So what should coaches be aware of before their athletes return to training?
I think most importantly is to just do a quick status check of where their athletes are in terms of their injuries. So some athletes might have already had injuries before going into circuit breaker and into phase 1 and before coming back to phase 2. So having a check of how the injury has been during the circuit breaker period or the home-based training period, what they did to rehab it, and then are they fit enough to go back to normal training now? And also if they are thinking of, I think some coaches will be thinking of doing like a fitness test to gauge where the athletes are, just to take note that these athletes are actually fit to do the fitness test. Because if they're not, one is you'll skew the results, it won't be an accurate representation of where the athlete is. And also secondly, the fitness test might actually cause an injury if they're not at a status where they're actually ready for it. And then the other thing to note is don't expect your athletes to be well and fine also during circuit breaker. Maybe it might not be the home-based training, maybe they're clumsy, they tripped, they sprained an ankle, you know, but they didn't tell you because you'll sound a bit silly, you know, I was walking and then I tripped on my own foot. But just to check that, you know, if they did sustain such an injury, what did they do about it? Yeah, because they might think that is nothing, but maybe there was some weakness or some form of weakness that set in that needed addressing that they didn't receive. But just to be aware of all these things that can happen.
So what's the principle do you keep in mind when you plan a rehab program?
One good analogy or we always use is the Goldilocks principle. So if you remember the childhood story of that just nice porridge, bowl of porridge. So the same thing applies for rehab. What we want is we load the athletes at a level where it's just nice for them. Yeah, because when you do any form of exercise, it's actually putting stress on our bodies. So what we want to do is actually achieve what we call a super compensation. So you actually get better and stronger from the training. So with rehab, that's the main goal. We avoid two other scenarios. One is where we give them too little. You know, you give them too little, they're actually not going to improve very much, and you're just wasting that person's time. But on the flip side is you don't want to whack them too hard, because you whack them too hard, they're gonna get flat out too fast even before they get stronger. So it's always that just nice principle that we look for.
So any final word for coaches out there, the national youth coaches out there?
So I think the best caption or in line with the whole COVID situation is we all want to be safe rather than sorry. So for example, wherever we go, we wash our hands, we sanitize our hands, we wear masks, okay, just to avoid any unnecessary cross contamination with people who might have had it before us. So similarly for us, we would advise coaches to be safe rather than sorry in terms of loading. So if you're not sure exactly where your athletes are at when they come back to training with you, load them lesser first, because you can always load them more once you have established where they're at. But if you load them too fast too soon and they get injured, they're going to be taking a lot of time off just to rehab from the injury before they can get back to their original program. Yeah, so I would say be safe then sorry.
Okay, thanks, Jocelyn. Thanks for taking the time to go through some key considerations for national youth coaches out there.
No
So thank you,
problem.
everybody, for joining us, and we'll see you next time.